Welcome back. Well, here we are in Module 6, and this arguably, in my opinion, is the most important module. This is your day one procedure. So this is the first impression that a new patient gets when they decide to come into your office, however they got there, whether they came in from some marketing program you had, whether you did a talk, whether it's a referral, whatever the case is. This is where you set it all up. So what you do on day one can really impact that new patient and their progress through the course of care in your office and whether they decide to become a lifetime patient. So here are some high level things that we're going to talk about on day one, procedures and systems, communication that really should happen for that patient to have the best response, to have the best experience, and get the education they need to make a good informed decision about their own personal health and their association with you as a patient in your office for the long term. Okay, so here we go. So let's think about this. What do all patients want? And let's just assume every single new patient that comes to your office wants these three things. They want a quick fix. Remember, it's the medical mindset. And it might not be the absolute truth, but let's just assume that's the case. And if we can assume that's the case, we're going to put the right things in place to take them from where they're at and their thinking into where you want them to be as a good quality warrior patient who understands what you're delivering. So they want a quick fix. They want to come how many times? Well, once. They want you to fix them then so they're out of pain, get out of pain as quickly as possible. And how much do they want to pay? Well, the majority of people, next to nothing. So none of them are coming into your office unless it's some very outlier, very much an outlier or an extreme situation, thinking that they're going to have lifetime care. So the objective is we want to build as much trust and rapport as possible. We want to create a sense of urgency, and we want to start an education process to introduce the cause of their problem, not just treating the symptom. So here's some action steps. So nurture prior to the arrival. We want a pre-call from the CA, or better yet, from the doc, to talk about what their experience is going to be like. Maybe to do a brief history. And some key questions are, what is their symptom stopping them from doing? What lifestyle changes would happen if they didn't have that system? That's something that we really want to anchor our communication to. That's their big why. They don't come in because of the pain, they come in because of what the pain is stopping them from doing in their life. That's the big why. So we manage their expectations. We can talk about the process and talk about the fact that they probably won't receive an adjustment the first day. And that's something that I would encourage everybody to consider, is that if you're regularly adjusting people on the first day, in my opinion, you're demeaning the value of chiropractic. The first day is a discovery, it's communication, it's examination, and you're setting the stage for the next stage, which is their care. So we manage their expectations. We can pre-frame that we're a family care office. We can talk to them about the fact that many patients bring their entire family in and even children to get checked as well. So we can ask them on their first visit, would this appointment be just for them, or would it be for them and their family? Because many families ask, can they also have their kids checked? It's the same as a dentist. Many families go in together to have their dental checkup. Same mentality. Let's have families come in for a chiropractic checkup or a chiropractic exam. And if they're a referral, we make sure we recognize referrals. If they came in from some marketing process, then we can talk to them about the fact that, hey, it's great you came in from our Facebook ad. Many of our patients, or the majority of our patients that come to our office, come in because they were referred by one of our current practice members. So we're planting seeds. So we have a streamlined patient intake. We'll use digital forms wherever possible. If you're still using paper forms, it's time to switch. Let's get into the age where people can actually fill out the form on their phone before they come into the office. It's going to streamline your procedures. That's a really easy fix to make. So they fill out before their arrival. It saves you time. You can keep on time rather than having somebody come in and take 15 or 20 minutes to fill out the form. We can ensure the front desk staff is going to greet them very warmly for every patient that came in. We always had the mentality that every single new patient that came in was the most important patient of the day. They would get up out of their chair, they would walk around the desk, they would greet them with a handshake or even a hug. welcome to the office. It's very different. We're trying to create a different scenario than what they would experience at the medical doctor's office. If you can imagine walking into the medical doctor and they walk up to a wall with a glass window and the person behind them doesn't even acknowledge them until they finish typing or get off the phone, and they slide the glass window open and say health card or something not very friendly. We want to be the exact opposite of that. We ask intentional questions, again, to discover their big why, and then we would give them the office wow tour. So we try to make them feel right at home. The next step of the day one process. So we do a comprehensive consultation. Now, what does that mean? Well, we want to really understand the patient's goals and concerns. So think back when you graduated from school, your consultation was all about managing their pain or finding out more about their pain, where it originated, how long has it been there, does it radiate? All you remember the low Dr. Fakera mnemonic. So we want to get away from that, and a lot of their symptoms have been listed on their form if you're using a good digital form. And now you can start asking lifestyle questions. How is this problem affecting their life? How does it affect their relationships? How does it affect their activity, their exercise? So we want to get down to the real thing that's got them to come in here in the office in the first place. We ask permission to educate them on healing. So we're going to go through, and when you're a client, we talk about the day one scripting and the fact that we start talking to them about how their body has an opportunity to heal. If a cut heals on their finger, we don't have to think about that cut healing. The body just inherently knows how to heal that cut over the next 2, 3, 4, 5 days. Well, that same healing applies to every single system, every cell, every organ, every tissue in their body. And that healing happens through the nervous system. So if they start to understand that the nervous system is the master controller and the facilitator of all healing that happens in the body, when we can introduce the idea that there's interference in the form of a subluxation, a misalignment of their spine, an abnormal curve in their spine, decay or degeneration in their spine, that is the root cause of what their symptom is presenting. So we want to get to the root cause. That's really important. So questions are the key, is asking them questions specifically about what they understand or directing them into an understanding of getting to the root cause of that problem. So we talk to them about the problem getting worse. If they chose not to do anything about it, and this happens on day one, if they chose not to do anything about it, what would happen? And so we lead them into that answer. So they have to process, think about it, and actually verbally say, it's going to get worse. And once they do that, something happens inside their brain to get them to think this is a more serious problem than I initially thought of. It's not a simple muscle strain. It's not a tweak. I've actually got something going on in my spine, in my nervous system that is compromising my health. We also talk to them about where those nerves go. They go to not just the muscles that are sore or not just down the legs or causing the headaches that they may have came in with. They also go to the organs. And if those nerves are compromised because of degeneration, decay, subluxation, then those nerves are being irritated, and that can cause those organs to start to degenerate as well. So questions are the key. So that's the first part, is putting in the proper consultation to start the education process. Then we ask permission to go through the exam. Would you like to go ahead and go through the exam to see if we can find out the root cause of this problem? The answer is yes, fine. Our examination has to be very objective. And if we're still doing orthopedic tests or pain management tests, we're only strengthening and confirming the fact that we are treaters of pain. So we want to try to get away from that. We are not treaters of pain. We are trying to get to the root cause of the problem. So all of our testing needs to be consistent to find the root cause. So tests that find abnormal posture, tests that find subluxation, tests that find abnormal range of motion, that will affect the body neurologically. And if we can objectify or quantify those tests, that's where it becomes really valuable. So posture analysis, range of motion tests, neurological assessments, if you're using some sort of a thermal scan or an EMG scan, these are measurable. And then down the road, they can be measured and compared at their re-examination, their progress examinations. We introduce these tools like thermography. For those that are using X-ray, this is the best way to show people any type of misalignment, damage in the spine, decay, osteophytes, disc degeneration. That's a great way to associate damage in the spine or misalignment, subluxation to nervous system neurological problems. So we start to get them thinking differently than that pain-based mentality. So we're minimizing and eliminating the pain-based testing. And then we have clear next steps. So at the end of our examination, we want to schedule a follow-up after the time we get a chance to go through their exam findings, take a look at that, develop some sort of a care plan. If, and here's the big if there's somebody that we feel we can help, and we clearly state that to the patient, I don't know if I can help you. I want to go through all of these tests. I want to make sure this is something that I can help you with. I don't know if I can accept you as a patient until I'm confident that this is something that I can help you with. So we have urgency. We schedule the follow-up appointment, day 2 with urgency, and that's the time to talk to the team about what happens next. So by the time they're leaving their day 1 appointment, the team is ready. They have a system in place to suggest to that patient, this is exactly what happens next. We want to try to create as much urgency as possible so that that day 2 appointment happens ideally the next day. If the person's really acute, sometimes we'd even do it the same day, later that day, but some time in between for us to get a chance to look at the x-rays, look at the testing, see exactly what's going on, and develop some sort of a plan. And then every single time, without fail, we would do a day 1 phone call. Call that patient at the end of the day. And this is the wow itself, the fact that they're getting a call from the doctor and not a text message, a call to basically say, I did have a thorough look at your x-rays. I had a thorough look at your exam findings. I looked at your case file, and you absolutely have a problem that I can help. So you're giving them hope. You create, again, urgency. This is certainly something we need to get on top of right away, because if we leave it, it's going to get worse. So we want to make sure that you're scheduled for the very next day. You confirm their appointment for the very next day or whenever that day 2 is scheduled. And even introduce the idea that many patients ask if their spouse can come and see their x-rays, and we will address that when you're here on day 2, so we can set up a time for you and your spouse to see your x-rays to determine exactly what your concerns need to get the problem corrected. That makes a great day 1. You're starting to begin the process to get that person out of pain thinking, pain-based mentality into root cause, the correction of root cause, and overall lifetime wellness. Hopefully this helps. We'll see you in the next module.